Question 1. A 16-year-old girl presents with a history of recurrent sinus infections, chronic diarrhea, and a recent episode of anaphylaxis after receiving a blood transfusion. Laboratory findings show serum IgA, normal IgG, and IgM HIV test negative. Which of the following is the most likely diagnosis? A. Common variable immunodeficiency. B. Selective IgA deficiency. C. Hyper IgM syndrome. D. Severe combined immunodeficiency. E. X-linked agammaglobulinemia. Correct answer B. Selective IgA deficiency. Explanation. This is the most common primary immunodeficiency. The hallmark is low serum IgA with normal IgG and IgM. The history of anaphylaxis to blood products suggests anti-IgA antibodies reacting to donor IgA. Diarrhea and respiratory infections are also common. A. CV typically affects all Ig types and presents later. C. Hyper IgM has high IgM, low others. D. Has profound immune deficiency from infancy. E. XLA shows all Igs and absent B cells. Question 2. A 24-year-old man is being evaluated for chronic giardiasis and mild asthma. Lab studies reveal low serum IgA with normal IgG and IgM levels. He is diagnosed with selective IgA deficiency. Which of the following is the best explanation for his susceptibility to recurrent giardia infections? A. Deficient IgG opsonization. B. Impaired neutrophil chemotaxis. C. Decreased mucosal immune defense. D. Loss of cytotoxic T cell activity. E. Absence of natural killer NK cell function. Correct answer C. Decreased mucosal immune defense. Explanation: IgA is critical for mucosal immunity, especially in the GI tract, where it neutralizes pathogens like Giardia lamblia. Selective IgA deficiency leads to poor mucosal defense and chronic parasitic infections. A. IgG opsonization is intact. B, D, E. These are not typically impaired in isolated IgA deficiency. Question 3. A 30-year-old woman with selective IgA deficiency is suspected of having celiac disease due to chronic diarrhea and weight loss. However, her serologic screening test, IgA anti-endomysial and IgA tissue transglutaminase, is negative. What is the most appropriate next step? A. Start a gluten-free diet immediately. B. Repeat the same IgA test in 3 months. C. Test for IgG-based anti-tissue transglutaminase antibodies. D. Order an upper endoscopy with random colon biopsies. E. Diagnose functional GI disorder. Correct answer C. Test for IgG-based anti-tissue transglutaminase antibodies. Explanation: standard celiac serology tests rely on IgA-based antibodies. In patients with IgA deficiency, these tests can yield false negatives. Therefore, IgG-based testing, e.g. IgG anti-TTG or IgG anti-GP, should be used instead. Serology or biopsy confirmation is needed first. B. Repeating the same test won't help in IgA deficient patients. D. Colon biopsies are not diagnostic for celiac. Functional diagnosis is premature. Would you like a comparison chart of immunodeficiency?